Hi everyone! Did you know that you should not drink green tea during your pregnancy? I'm Dr. Carolina Melgar. I'm a practicing cardiologist specifically focusing on babies' cardiovascular health. And today I want to talk about 7 products that can cause fetal arrhythmias. Fetal heartbeat irregularities might be more common than you think. If your doctor detects these changes, he might ask you about your diet or the substances that you're using. You might be eating or drinking products that contain caffeine without knowing it, and this can change your baby's heartbeat. An irregular fetal heartbeat or a fetal arrhythmia can happen when his heartbeats are too fast or too slow, or if there are any skipped beats. You see, the thing with fetal arrhythmias is that they can sometimes indicate a serious problem, like a cardiac malformation. That's why every time we detect an arrhythmia, we have to do several tests to confirm whether there's a congenital heart defect causing that abnormality. Having said this, most irregular heartbeats are caused by lifestyle factors. Many times when I spot a fetal arrhythmia, I start asking about the mother's diet, medication, and other substances that she could be using. This way, I can usually identify the trigger. So let's take a look at these 7 products that can cause fetal heartbeat abnormalities. So, number 1, coffee. Yes, coffee, that dark, sweet elixir that fuels up my mornings. No wonder it's number 1 on my list. As you may have noticed, caffeine can cause your heart to race. It's what gives you an energy boost. Unfortunately, though, that effect may be passed on to your baby. Too much caffeine can make a fetal heartbeat increase, and it can also develop fetal arrhythmias. This happens because high amounts of caffeine could increase your baby's catecholamines, which are released into the bloodstream when somebody is physically or emotionally stressed, and this in turn might cause an increased heart rate. This is just one reason why coffee is a substance you should limit during your pregnancy. Studies also show that consuming more caffeine is linked to a higher risk of giving birth to a baby with low birth weight. But all these studies are based on large amounts of caffeine, and truth be told, it's not the case for most of us there. The conclusion is that pregnant women should stick to 1 cup of regular coffee per day. More specifically, they should limit themselves to no more than 200 milligrams of caffeine per day. This is important to keep in mind because coffee brands have different levels of caffeine. If your intake of caffeine is no greater than 200 milligrams and your baby's still experiencing irregular heartbeats, you might want to try counting your daily caffeine milligrams. This is what I mean. You might think you consume under 200 milligrams of caffeine a day, but in reality it could be more. This could be the case when you drink different brands of coffee on different days. For example, Starbucks coffee is more caffeinated than the brand you use at home. And even if you already cut down on your coffee intake during pregnancy, remember that we're not all the same. You just could be more sensitive to those effects. A good way to test this is to stop drinking coffee and see if the problem continues. With that being said, if I have a patient that is experiencing fetal arrhythmias, I will always advise them to stop drinking coffee altogether. When you're considering the amount of caffeine that you consume, make sure you include the tea that you drink. Although it typically contains less, a few cups could send you over the limit, possibly causing irregular fetal heartbeats. Remember that each tea contains a different amount of caffeine, so be sure to check the label. To give you an idea, 1 brand of black tea may be 20 milligrams a cup, while another could be 90 milligrams. If your baby has an irregular heartbeat, you might want to play it safe and stick to herbal teas that are naturally decaffeinated. Not herbal teas are safe though. Some contain plants that haven't been proven safe during pregnancy, like Arabian jasmine, guava, hardy rubber tree, Japanese persimmon, oolong tea, and green tea. Now I want to comment on this last one, especially green tea. Green tea has a large amount of polyphenols. Polyphenols are common natural substances that come with many benefits. Studies show that they can improve your heart health, your cognitive health, and even lower your blood sugar levels. Now, during pregnancy, they should be avoided. Research has found that they produce constriction of the ductus arteriosus, which decreases the blood flow to the baby's lungs while inside the womb. I would love for you to know more about this. Check out my video on 15 foods and drinks to avoid during pregnancy. So, number 3, sodas. Sodas also contain high amount of caffeine. Some flavors, such as brisk peach tea, only contain 8 milligrams. However, Pepsi contains about 38 milligrams per can, and a can of Coke contains 34. So, drinking a few throughout the day may lead to changes in your baby's heartbeat, and of course your own. If you're looking for caffeine-free alternative, you can try Sprite or 7-Up. Now, number 4, dark chocolate. Keep in mind that chocolate also has a small amount of caffeine. Studies show that cocoa had a stimulating effect on fetal heart activity. This is due to theobromine, which is also present in coffee. So having said this, remember that if you eat large amounts of chocolate or small amounts with other caffeine sources, it could cause fetal arrhythmias. Number 5, energy drinks. Whether it's a can of Red Bull or Monster, it can contain up to 34 milligrams of coffee, while an energy shot can contain up to 80 milligrams a bottle. They're not healthy for the average person, and they're especially dangerous during pregnancy. I know that fatigue symptoms can make it tempting, but to all you moms out there, remember that they also have other unsafe ingredients. There's a new study that shows that energy drinks during pregnancy can cause liver, kidney, and brain disease to the baby. Number 6, migraine medication. Migraine medication often contains caffeine and ergotamine. They're used to treat certain type of headaches like migraines and cluster headaches. It works by blocking the pain signals and narrowing the blood vessels in the brain. The problem is that not only they can narrow the blood vessels in your brain, they can also narrow them in the placenta. And remember that your baby's blood vessels are developing during your whole pregnancy. That's why these medications can be dangerous. The caffeine that these drugs contain can also cause irregular heartbeats. If you're on migraine medication and your baby starts having irregular heartbeats, your doctor may switch them to a different one to see if that's the cause. Always tell your doctor about any medications you're taking during your pregnancy. Number 7, smoking during pregnancy is already bad enough. It's dangerous for many reasons, including the risk of fetal arrhythmias. This also happens with other forms of nicotine, such as vaping. If you're smoking during your pregnancy and you're having trouble quitting, contact your doctor. There are always resources for us to help you with. So having said all this, a fetal Doppler, a handheld device that you can use at home, allows you to hear your baby's heartbeat between your checkups. You can also see their fetal heart rate on the display screen. If you use a fetal heartbeat monitor correctly, you may begin seeing patterns and recognizing what is normal in your baby's heartbeat. When something seems off, you can contact your doctor and even send him a recording of what you heard. I can't tell you how much this has been helpful for me with my patients. So, the fetal Dopplers can detect irregular heartbeats, but of course the treatment will depend on the diagnosis, and your doctor will most likely order more tests to see what's going on. So, that's all we have for today. I really hope this information is useful for you. If you have any questions, I'll be more than happy to answer them. Just leave them in the comments below. I'm Dr. Carolina Melgar from Sonu Health. Thank you for watching.